and start recording and go.
Hello, everyone.
People are joining.
Yeah, we're going to give people a chance to settle in. Hi, everyone. I'm just going to wait a few minutes until everyone else can join.
Hi,
So,
Raoul.
Feli, so what's your specialty?
Neuropsychology.
Awesome.
So I'm obsessed with the brain, basically. I think all of us are
Yeah.
obsessed about brain.
We're just completing a study with police officers suffering from PTSD, looking
Wow.
at the neuropsychological impact.
Yeah. That's in McGill. The study is in McGill.
The study, it's my graduate student. She's just about to submit her thesis.
Congratulations.
A number of moderate effects, impact. It's not as bad as we used to think.
In what sense?
Most study participants still score within normal range on most of the measures, but lower, but remaining in the normal range.
Okay.
Which is a good news.
Yeah, that's clinically meaningful, so that's great.
But it is clinically meaningful to them.
Yeah.
They see a difference. They still see the difference, but they still manage to function at a level considered normal.
That's amazing. That's quite good. So make sure you spread this research study as wide as possible.
Yeah, for sure.
So hi to everyone who's joining. We're just giving the other people a few minutes to join and settle in. The attendees keep going up. Okay. I think we can start at like 10:05.
Yep.
So in like 2 minutes. Hello, Yusuf. It's great to have you with us.
Hi, guys. Sorry, I'm supposed to be a participant only.
You're much more than that, Yusuf, always.
Okay, just 2 more minutes and we'll get started. Just out of curiosity, where is everyone located now? Where is everyone tuning in from? Do we have anyone outside Lebanon or outside London? You can type in the chat. Oh, Lebanon.
Yes.
Exciting. Oh, wow.
This is phenomenal. There's someone from Paris, someone from KSA.
Montreal is just my family.
Motherland.
Yay, Lebanon. Great, Seattle. Oh, wow, you're excited, Nicole. Lebanon, awesome. More and more people joining. Wow, Belarus. How did you hear about this? Impact Lebanon's page?
I think that's my family.
Oh, yeah. Okay, I think we can get started with the introductions, and then people will get a chance to join. Okay, so hi everyone. Thank you so much for being with us. We're so excited about this weekend. Thank you for being a part of it. We're gonna get started. Hello to everyone who just joined now. Okay, so this talk will give you a chance to learn from trauma expert, Dr. Alain Brunet and Nathalie Ferran about trauma and about reconsolidation therapy, which is a treatment method aimed at healing traumatic wounds. So Nathalie Ferran, whom I'll introduce in more detail in a second, is going to talk about mental health, trauma, and PTSD amidst the crises in Lebanon for about 15 to 20 minutes, followed by our esteemed guest speaker, Dr. Alain Brunet, whom I'll also introduce in more detail later on. He will also speak to you for about 15 to 20 minutes on therapies available to treat trauma and PTSD, including his innovative treatment method called reconsolidation therapy. And finally, we'll have a window of 15 to 20 minutes for you guys at the end to ask questions, but feel free to write them out in the chat as they come up for you or at the end. And first of all, I'd like to thank Impact Lebanon for hosting this. Impact Lebanon, just to give you context, for those who don't know, it's an initiative hub for driven Lebanese around the world. And if you want to be part of any of their initiatives, you can join through the link that they will put in the chat. Yusuf or Miriam, if you can please put a link so that if we have any motivated volunteers, they can join and be a part of your wonderful initiative. Okay, so just as a reminder to our speakers, this is less of a formal talk, so feel free to jump in on each other's talks if you have anything that you would like to add. So without further ado, Nathalie Ferran is a neuropsychologist who primarily worked as a senior research assistant at the American University of Beirut. She is currently a clinical doctoral candidate at King's College London and a certified mental health ambassador, recipient of the Raja Salam Scholarship Award. She has also received the Rosa Burden North Bristol NHS Trust Prize and the Shane McCollum North Bristol NHS Trust Prize. Long prizes, Nathalie. They seem like important prizes. So Nathalie, thank you for being with us. And the virtual floor is yours.
Thank you, Lyra, for this grand introduction, and absolutely for making this event happen with Impact Lebanon. It is absolutely crucial and timely, and it is crucial and timely because clearly these are unprecedented times for Lebanon in every single way. And if I could summarize the situation in one phrase, I would say that right now Lebanon is the epicenter of trauma. So the nation is facing numerous difficulties, numerous crises on a daily basis, 1 minute to the other, and things are just getting worse by the day. So it would be important to hold this in mind as we discuss trauma in our session today, and somehow appreciate that the general mental state of people in Lebanon right now is that of survival, rather than having this kind of good quality of life. So in a nutshell, Lebanon has been facing a steep kind of downhill road when it comes to its economy since 2017. And with that, there has been drastic consequences on human capital and the human stability and the stability of the country. Officially, right now, more than 50% of the Lebanese people have fell below the poverty line. We also have a food crisis, and a lot of people have lost their jobs and they have lost their income. We have a massive brain drain, including healthcare providers and including mental health providers. Clearly, we are still battling the COVID-19 pandemic, as are other countries, but Lebanon is one of those countries that's doing that with minimal resources and minimal support. The recent news and the event of the Beirut blast kind of shook the whole world, and we know the sheer number of people who have died because of the blast, many people who were injured because of the blast, and the hundreds of thousands who have lost their homes because of the blast. And for a while, we have been having ongoing political crisis. So all of these adversities happened in a span of 3 years in a country with kind of suboptimum healthcare, poor infrastructure, insufficient public and mental health services. And what we are seeing is this kind of compounded effect of different types of trauma. So it's not just one trauma, it's a lot of adverse experiences that have been happening in such a short span of time. I personally believe, and many other mental health professionals believe, that we are also witnessing like another crisis when it comes to the mental health of people and their psychological functioning. So again, just to put things further in context, we need to really understand that people in Lebanon are predominantly thinking about their survival, meeting their basic needs, and ensuring that their families and their loved ones, the basic needs of them are also being met. So the mental state of people is that of survival right now. That's the situation in a nutshell.
Yeah, exactly.
Yes. So with that, and tapping into the core of our talk, the question of mental health clearly arises. And again, research shows that this cumulative kind of effect of adversity has a more lasting negative impact on the person's health in the short term and obviously in the long term, including the well-being of children who are quite vulnerable to stress, even though they are quite resilient at the same time. It's important also to keep in mind that one important predictor when it comes to our mental well-being in times of crises is the financial stress that we are facing. And generally, international guidelines and kind of committees, they recommend that whenever we plan any response in mental health when it comes to crisis hit nations, we take into account poverty and the financial situation of the people. It seems that we are heading, hopefully not, but it seems that unfortunately we are heading to a very dark place, and this dark place is somehow becoming more vivid as days pass. And people are not just reacting to the explosion itself, which was a massive hit to the nation, but people are reacting to years of systematic kind of oppression that also taps into the core of our mental well-being. So essentially teasing apart the psychological impact of each of these recent tragedies is extremely complex, again, because of this compounded effect. There have been few studies that were done in Lebanon recently. One of those studies was published in 2020 after the economic downfall started. The author is called Pascal Saleme. And basically what they managed to show was that there is a very strong negative effect of lockdown, of people being in self-isolation. And there is this very strong negative effect due to the financial stress. But when you merge both of these things together, then obviously you get an even bigger compounded effect above and beyond, in principle, putting those together in the sense of 1 + 1 = 2. In this sense, 1 + 1 does not equal 2, but a little bit more than that. A lot of the people who were studied during the lockdown and participated in research, most of them reported that their mental health has deteriorated drastically. There was a study that was done on Lebanese bakery workers. It was shortly before the blast, and the authors managed to interview a very big number of bakery workers in Lebanon from across different areas. So not just in Beirut or in the south or in the north, but rather all areas. And 45% of these interviewees reported poor mental health. But among those participants who had a lot of financial stress, negative impact of that stress kind of doubled. And they were clinically depressed, and clinically they met diagnostic criteria for anxiety disorders. The World Bank looked at a lot of data as well and collected data after the blast. And what they found when they asked their participants who come from different kind of wealth categories, but it's not just people with low kind of income, but those with middle kind of income and even higher income. And they asked the participants, who were around like 3,500 people, what is your most pressing needs? The common answer was that the pressing need is mental health services. There's another study that was done recently after the blast. The results have not been published yet, but the authors managed to interview, it was around 2,000 people, and almost half of that population was close to the site of the blast, and the rest were a little bit further away. And what the preliminary results showed is that around 37% of all of these people had high symptoms of PTSD. And I'm stressing on the word symptoms because it's not really the diagnosis per se, it's just the symptoms of PTSD. The interviewees who were closer to the blast site, so closer to ground zero, the symptoms of PTSD were much higher, and 67% of them scored in the severe ranges of PTSD. And just to put things in perspective, and I will compare a little bit with another man-made disaster as opposed to a natural disaster. In New York, after September 11 terrorist attack, there was a big study about PTSD and symptoms of PTSD. And what that study showed was that 11.2% had high symptoms of PTSD. So 11.2% compared with 37% and 67% in Lebanon. That's quite high. Clearly, as many are, we are worried about those who are vulnerable, so people from minority groups and children. And we know through research that this kind of toxic stress and this prolonged adverse experiences feed into this child's biology and neurodevelopment. And these children become more prone to many psychological difficulties and a lot of mental health disorders, including PTSD, including depression, including bipolar disorders and suicide, as well as suicide. There was another study as well that was done in Lebanon. That was after the blast. Sorry, that was before the blast, and it was around suicide in children and adolescents and suicidal intent. The authors want to repeat that study now after the blast. And what they saw is that around 13.2% of Lebanese children have suicidal
wow.
ideation, which is very high. This is very high.
Really high.
Yep. Yeah, so that's an alarming number. And all of these research studies show kind of alarming picture and a pessimistic picture about the current mental health status in Lebanon. Sadly, the crisis is affecting the services that can help people heal and grow out of this kind of seemingly endless distress. We have a shortage of psychotropic medications, for example. A lot of people who were somehow maintained well despite their mental health difficulties relapsed after the blast. And if right now you open the chat and ask people about certain narrative, most of them will tell you that, yes, this narrative resonates with me. And the narrative goes like, I was feeling depressed before the blast with everything that was happening. I was feeling anxious. I was not doing well. I was barely functioning. But then the blast happened. I broke down. So this is a very common narrative around Lebanese people. So it seems that a lot of pain has somehow surfaced up in different forms. And again, I want to stress on the role of socioeconomic kind of status and financial stress, because in developing countries, this plays a very big role. There is a model, a quite famous model that's called the reserve capacity model. And what this model basically says is that as humans, we rely on several resources to cope with tragedy, to cope with adversities, and to just carry on in our lives. Those resources can be economic resources, they can be energy resources, work resources, and kind of social resources. And what this model indicates is that once you get this drastic kind of hit in terms of your finances, all of these resources somehow get depleted in a much quicker way and they get taxed earlier. So you become so vulnerable to the negative effects of the upcoming adversities. And again, Lebanon in the past 3 years has faced so many different adversities, and something that's happening every day. So I would not be surprised when people say that I can't cope with this anymore, because most, if not all, of our resources have been depleted. So that's the picture as a whole when it comes to the mental health kind of scene in Lebanon. Despite this pessimistic view, I am still hopeful. And I believe in our mental health workforce, including you guys with the event today, which is great. And I believe in the people of Lebanon.
Thank you for ending on a positive note after all this data showing how badly we are off in Lebanon. Did you have anything more that you wanted to add, Nathalie, before?
Maybe I can just define trauma a little bit and hand over to Dr. Bruni.
That sounds perfect. Please go ahead.
Okay. I think it's important to clarify that trauma is actually a response, and it's not really measured by the trigger itself, but is rather measured by the response. It's only normal for people to react in negative ways post-traumatic event. And generally, a big proportion of people recover after a traumatic event. So PTSD in general, post-traumatic stress disorder in general, has this naturalistic kind of recovery rate, and only a minority get diagnosed with PTSD. The problem with that is that you can heal naturally from this traumatic event if the environment around you allows that and supports that. And by environment, I mean by everything around the person. So if someone is struggling to meet their basic needs, they're most likely not going to recover from such a trauma. And that's absolutely crucial. So PTSD in general has few hallmarks. Usually people with PTSD somehow re-experience the event. So they might get these intrusive kind of memories, these bad intrusive feelings. A lot of them would try to avoid the situation. A lot of them would have this kind of hypervigilance, hyperarousal, and their cognition might change. And this is key for treatment. And at some point, I will hand this over to Dr. Brunet, is that when we work with individuals who have PTSD, we are usually working with people who their kind of memory of the event is shady and gray and not particularly clear and is pathological to the person. So the goal of therapy is to build a positive relationship between the person and this memory. That's it for me. I can hand over to Dr. Brunet.
Thank you so much for this insightful talk, Nathalie. So now we're gonna give the floor to Dr. Alain Brunet, just so I can introduce him to people who might not know him. Dr. Alain Brunet is a world-renowned expert on PTSD. He's a professor at the University of McGill, the former co-editor of the Journal of Traumatic Stress, and former president of the International Society for Traumatic Stress Studies. He is the director of the Lab on Psychological Trauma at the Douglas Mental Health University, where he has been conducting research on trauma for the past 25 years. Dr. Brunet, thank you so much for being with us today, especially on a Saturday. It's an honor to have you here, and we're very excited to hear you. So I will not be delaying you any further. Please go ahead. The mic is yours.
Thank you very much, Lara. Thank you, Impact Lebanon and Nathalie. By the way, it's Vice President of ISTSS, not President. Well, first of all, I want to say that I am a big fan and a big friend of Lebanon. I was there on several occasions, and I have very fond memories of having coffee in Ashrafieh and other places. You can leave your heart not only in San Francisco, you can also leave your heart in Lebanon and with the Lebanese people. I guess one of the questions that many people struggle with is, what can we do? What can we do about the situation in Lebanon? And organizations like Impact Lebanon are trying, obviously, to help. And obviously, there is no single solution that will fit and help every problem. But we're here today together to address one small part of this problem. And I'm talking here about the psychological impact of the various traumatic events and adverse experiences that have been striking Lebanon over the last several years. And as Nathalie was mentioning, clearly the normative response in times of crisis is resilience. And I want to emphasize that. It's very important to understand that in times of crisis, most people will be resilient, and most people will need just a little bit of help, okay? And so this is the job of public health planners to provide this little piece of help. It can be, for instance, by disseminating important and useful information, and so on. And essentially, when people are confronted with a crisis, their most basic needs are the ones that they need to fulfill before, like needs of safety, need for food, need for shelter, which I think were pretty obvious when the explosion in the harbor occurred, and a very large number of housing was destroyed. So Lebanon is experiencing a myriad of adverse events. And of course, there is no one-size-fits-all solution. But first of all, we know that resilience will be the normative response. And those guys, those people, we can leave aside because we know that most people will be okay. So then we are, as mental health professionals like Miriam and myself, we are concerned with the more severe cases. And in trying to address the question, what can we do about what is going on in Lebanon? Well, one sub-question of this is, what can we do about the people who have been psychologically traumatized due to the harbor explosion? But it can be also in other contexts because of the war or because of the refugee situation. There has been, several sources of conflict and sources of trauma. And there are essentially three approaches to trauma. We call it primary, secondary, or tertiary prevention. Primary prevention is the job of people working in embassies and governments. And it's essentially to try to prevent a trauma or a traumatic situation from happening. Now, clearly that did not happen, unfortunately, with what happened. What happened in the harbor was a preventable event, but unfortunately now we have to deal with it. Secondary prevention would involve preventing the development of PTSD or traumatic stress. People have been exposed and now we're trying to do something to prevent them from suffering from PTSD. And that is still the job of policy planners, and we're still working at the level of a community response, okay? Social support, disseminating information. This is really still at the level of the community. But then comes the issue of what about the people who have been trauma exposed, who did develop PTSD? How can we diagnose them? How can we identify them? And what kind of treatment can we provide them? Now, it so happened that probably in every Lebanese family, there is probably someone who is struggling more and who is experiencing symptoms of PTSD. So how, as a family member, can I trace the line? When does someone need help? At what level, of symptoms should I start to worry? And if I had a single symptom to look for and to monitor, it would be that of a nightmares. If you know someone who is reporting a repetitive nightmare, and if the content of this nightmare has to do with a specific experience that this person has gone through, the explosion in the harbor, or a physical sexual assault, or a war experience or refugee experience, nightmare is probably the one single symptom which is the most associated with post-traumatic stress disorder. So that is really a key symptom to look for. Now, why am I talking to you today here? It's because after the harbor explosion, and having been to Lebanon, having friends and colleagues there, we were touched by what happened. And we soon realized after the harbor explosion that there was limited expertise when it comes to the treatment of post-traumatic stress disorder in Lebanon. The number of mental health professionals is not very large, and not all of those members are cognizant or are well equipped to treat post-traumatic stress disorder. Now, we felt there was a knowledge gap there, which the International Association for Reconsolidation Therapy could help fill. And that's why we developed a crowdfunding opportunity, which involves training for free 100 therapists from Lebanon. Now, this action is ongoing. We have trained so far about 30 therapists. 30 more therapists should be trained within the next month. And we are accepting donations to promote those trainings. Now, there are several kinds of therapies that can be used to treat PTSD. I will just name a few so that people who know someone who's suffering from traumatic stress can be knowledgeable of those and can eventually contact a mental health professional and help someone suffering from PTSD reaching out for help. So essentially, PTSD can be treated in two different ways. The first way is by medication. The second way is psychotherapy. Now, there is no perfect treatment. So whatever treatment you prefer, it's partly effective. Medication is effective, but there are side effects to medication. Essentially, people suffering from PTSD will be treated with antidepressants, and sometimes other drugs will also be used concurrently. But the problem with antidepressants is that you know when you start them, but you don't know how long it's going to take before you can stop them. So you know when you start, you don't know when you finish, and then you have to deal with the side effects. Now, psychotherapy, there are various forms of psychotherapy. You might have heard of EMDR or CBT. You might have heard also of reconciliation therapy. Essentially, therapies are fairly short in duration and are considered the #1 treatment approach for PTSD. And in a matter of between 5 and 25 sessions, the success rate will be around 70%. And the one thing which is important here is not to start a psychodynamic or Freudian-like type of therapy, which is not suited for post-traumatic stress disorder. It's still, it's still the foundation of many therapies, but it's definitely not suited. 40 years of scientific work since the 80s attest to that. There are better treatment modalities than that. And if you're being offered psychoanalysis for traumatic stress, it's just going to be a financial burden, essentially. Now, I'm not going to talk much longer. I'm just going to finish by explaining what is reconciliation therapy, because it is less well known and it's a kind of unusual form of therapy. Now, I am both a scientist and a practitioner, which means that I have conducted a lot of research over the last 25 years, empirically validating a novel form of treatment. And we started from the standpoint that in order to suffer from traumatic stress, you need to remember that you experienced an event. And you need to remember that you experienced a terrible event. Now, it so happened that if we could decrease the strength of that memory, perhaps the symptoms would also decrease or even perhaps go away. Let me give you an example. Imagine your first love, the day when this person told you, look, it's finished between you and I. How did you feel at that time? Well, you probably felt like the world was gonna stop turning. And yet the next day, the world was still turning. Maybe after 1 week, you still felt quite ashamed of this or angry about this or depressed about this. But as time went by, this emotional memory gradually shrunk and became more manageable. Now, reconciliation therapy is really about decreasing the strength of an emotional memory, which is at the core of PTSD. And so in a matter of 6 sessions, where people will briefly talk about their traumatic event under a drug called propranolol, this treatment modality will help decrease the strength of the emotional memory underlying the PTSD by reactivating this memory and blocking it from being saved again to long-term memory storage. Especially the emotional component of that memory will be blocked. And so this treatment will consist in turning a traumatic memory in an ordinary bad memory.
So you're saying that they're still going to remember the event, but they just won't be disaffected by it. So the emotional component of it will be decreased.
People will still remember the memory, but it will have become a more ordinary bad memory rather than a very highly emotional and traumatic one. And research shows that we can achieve this result in a matter of 6 sessions. So I'm going to stop here because I presume that among the people who are listening, there are people who wish to add questions to Nathalie or myself.
Actually, I had a question myself.
Yes,
I was wondering if you could tell us how reconsolidation therapy fares compared to other therapies available out there.
Yes. So reconsolidation therapy has shown success rate between 70 and 86% of the patients treated, depending on the severity of the case. But most importantly, all the therapies that I have talked about, EMDR, CBT, medication, show similar success rates. The difference is the time it takes to treat patients. Some therapies are shorter than others. And also, the 2 other elements are relapse and side effects. With the medication, there are more side effects. And with cognitive behavior therapy and EMDR, there is an important relapse rate.
Okay. So I just wanted to echo what Dr. Brunet just presented. First of all, thank you for this wonderful talk, as always, and for sharing some of your knowledge with us. So I'd just like to explain that the initiative that he mentioned to train Lebanese therapists locally is a Lebanese student-led initiative by myself and my colleague Ram Harib. And it's supported by our professor, Dr. Alain Brunet, and by McGill University. And basically, all we want
as well as by Dr.
Sami Risha of the University,
Saint Joseph University.
The University of Saint Joseph of Beirut. And as you heard, reconsolidation therapy is cost efficient and highly effective, which is what we desperately need in Lebanon amidst these circumstances to quickly help people get back on their feet. It was also used after the Paris and Nice terrorist attacks with tremendous success. So we know it's highly effective in situations of urgency, and we'd love it if you could support it so that a maximum number of Lebanese people suffering from trauma can get the treatment they really, really need. So I put the link in the chat and I'll put it again, maybe if you'd like to share it or support it. Thank you so much. So I'll take a chance now to answer some of the questions that we have in the Q&A and in the chat. So we have a question, how long does it take to train a therapist? Dr. Brunet, in reconsolidation therapy, I imagine.
It takes 3 days to train a therapist, which is it's a training of intermediate level. It takes 3 days to train a therapist who is already trained as a therapist, of course. So
Okay.
it's very quick. After 3 days, therapists have all they need to begin using this therapy.
That's amazing. And we have another question. Can psychiatrists provide this therapy? So only psychiatrists
can provide the therapy. Psychologists can provide the therapy too, as long as the patient sees his or her doctor to receive the propranolol and make sure that they can safely receive propranolol.
I'm understanding the question now, which is, can only psychiatrists provide this therapy since it includes medicine?
Right. So I already answered.
Okay, so therapists as well, any mental health professional that has training. So as opposed to EMDR, reconsolidation therapy can help decrease the emotional impact rather than the vividness of the memory. Would you care to answer that?
That's a subtle question. I think that EMDR, it's very difficult to tell exactly what EMDR does that's different, I mean, in terms of how people feel. What we know, though, is that when the relapse rate in EMDR and CBT among the people who benefit from it borders between 40 and 50% after 1 year, because those therapies have been studied to quite some extent. Reconsolidation therapy has been studied to a lesser extent, but animal research and research with healthy subjects suggests that when we have decreased the strength of an emotional memory, there is very little relapse.
Okay, great. We have a question on propranolol. So isn't that a beta blocker? How does it work in PTSD? Great question.
Propranolol is a beta blocker. We are using a particular and recently discovered side effects of propranolol. In other words, it's kind of a repurposing, if you would like, of propranolol.
You went on mute.
Yeah, you've been muted somehow.
So I was just mentioning that indeed the propranolol has been retooled or repurposed in this situation, and it's a fairly benign drug, and scientific evidence suggests that it crosses the blood-brain barrier and exerts its action at the sites where memories are being consolidated and reconsolidated by preventing the protein synthesis, which is required to consolidate that memory. So it is a repurposing of a drug, like many others have been done before.
And what it does basically is decrease the emotional component of the memory and acts on the parts.
Of the recalled memory only.
Yeah.
Yes.
Great, thank you. We also have a few more questions about reconsolidation therapies. So to add, how long are each sessions in reconsolidation therapy? And finally, can reconsolidation therapy be provided remotely? Also great questions and very timely since if you'll care to answer, Dr. Premier.
Mm-hmm. So we have trained 30 therapists in Lebanon. 30 therapists are currently trained to provide this treatment right now in Lebanon, and they can either work face-to-face or remotely. The sessions are about half as short, half as long as a regular session. However, if you suffer, if your need is really to talk and to vent and to seek social support by talking and by explaining, telling your story, you might want to revert to a more traditional support type of therapy. But in reconsolidation therapy, the sessions are very short. They focus on the traumatic event at the core of your nightmare or at the core of your main PTSD symptoms. And they last 25 minutes rather than 50 minutes. The good news about this is that you can be treated much faster and at a lesser cost.
That's amazing. Also, I want to take a second to invite people on Facebook who are watching us live to ask questions on there if they would like, and we will transfer them to the chat. We also have, what does the medication do exactly on a neurological level?
Yes, I have explained that already. Essentially, propranolol will block the protein synthesis required to fix a memory. When a new memory is formed or when an old memory is recalled, it needs to be saved again to long-term memory storage in order to persist. And if you interfere with this process, with this drug, the memory will remain, but the emotional part of this memory will be decreased. And so the memory that will persist is a less emotional memory. You will remember all the bad things that happened to you, but you will feel less bad as you remember them.
We also have a very expected question about side effects of propranolol. I can answer that if you'd like, and you can correct me if I'm wrong. But the side effects are mainly just slight drowsiness, which is just like having a glass of wine or a cup of beer. So that's all I know that it does, correct?
Yes, there are other less frequent side effects, but this is the most important. It's a little bit of sedation.
Okay. And we have a question about, psychologists cannot prescribe medicines in Lebanon. That's why only psychiatrists can use this therapy.
Well, a general practitioner could prescribe the drug to the patient, and then the patient could go see his or her therapist, and the therapist could reactivate the memory with the patient who has taken the drug by himself or herself. And so the patient could, the therapist could help the patient reactivate the memory. So that's feasible. It's the same situation in Lebanon, in France, in Canada, in the US. Obviously, the medication part can only be done by a medical doctor.
We also have a question. Would it be the same protocol if it was acute stress disorder?
Acute stress disorder is not, there is little evidence supporting the use of reconsolidation therapy in acute stress disorder, but it would be the same circumstances, yes.
We have a question for Nathalie. So Nathalie, you talked a lot about the Lebanese specific context. Do you think that the cultural stigma around mental health could prolong the impact of PTSD?
Yes, absolutely. The question of stigma is still a very big issue in Lebanon, even though there has been some progress in that context. But the major progress so far has happened with the younger generation as opposed to the older generation. So what we see is that the young generation is so open about talking about their feelings, their troubles, their thoughts, their fears, and their mental health in general. And that's kind of the main task force when it comes to people who are raising awareness around these things. And throughout the past years, again, we've seen some progress. For example, many TV Lebanese TV stations have been hosting experts in mental health to speak about these topics that are considered taboo. And we know that the Ministry of Health launched a program, or at least announced a mental health program in 2014. However, the issue of stigma can significantly prolong when does the person seek help. And research released in around 10 years ago, which I think has changed a little bit, saw that or resulted in quantifying the timescale that it takes the person to seek professional psychological help, and which was sadly around 28 years. I think this number has decreased now, but it's still quite a very long time. So first of all, PTSD might begin years past the trauma. It doesn't necessarily have to start 3 months after the trauma or 1 month after the trauma. It can begin at a later stage. And the more that the person prolongs that kind of time when it comes to seeking help, the more dysfunctional the person might be, and the more this person might sadly be affecting around him or her. So yes, stigma does play a role. Things are a little bit better than before. And we have seen major progress when it comes to the younger generations as opposed to the older generations. But still more work should be done.
Thank you, Natalie. We have 2 more questions about reconsolidation therapy. So first, this far, how is the applicability of reconsolidation therapy in Lebanon faring? It's a good question. And also, can it be used now in Lebanon with people who suffer from PTSD from the Beirut blast, or has too much passed? And is there a time frame for the effectiveness of this therapy?
It's never too late. The good news is that it's never too late to treat PTSD. As Natalie was saying, many studies suggest that people wait a very long time. About half of the people will go in remission within the first year or so, but the other half will not. And unfortunately, sadly, many people who could benefit from help do not seek help. Sometimes for good reasons, financial reason might be an obvious one, but sometimes it's more a matter of shame. There is a lot of shame and guilt and stigma around the issue of traumatic stress. People sometimes feel that they should snap out of it by how so, I'm not sure, but they should simply snap out of it. This is a common belief. So it's never too late to seek help, and any form of help is better than no help.
That's a great answer. And how is the applicability of reconsolidation therapy in Lebanon faring?
Reconsolidation therapy works wonderfully with identified trauma, like single type of trauma. It works extremely well. So if among all the traumatic events that the person has experienced, if one of them clearly stands out, then this could be the target of a 6-session treatment using reconsolidation therapy. If there's more than one event, several sessions can be also planned. But essentially, the take-home message today is really, if you know someone who has been suffering from traumatic stress, the good news is that treatments are available, effective treatments are available, and it's never too late.
That's a hopeful message that we really need. We have a question on Facebook. Is reconsolidation therapy effective with complex PTSD? Good question.
The evidence regarding complex PTSD is inconclusive. So far, most of the work has been done with non-complex PTSD, which does not mean non-severe PTSD. As we know, complex PTSD is the name of a different disorder. There is PTSD and complex PTSD, and those two disorders are about as similar as water ski and downhill ski. Both have the word ski in it, but that's about it. So complex PTSD is really a different beast, and reconsolidation therapy can be used as a multimodal therapeutic approach to treat it. But it's definitely a different disease entity, if you like.
Great. As more questions appear on the chat, I just want to take a second first to thank everyone for having joined, but also I want to remind everyone of the theme of our event, which is Mashaib, Dr. Brunet, this means it's not shameful. So Mishaib, to seek more information for your loved ones and for yourselves. Mishaib, to seek help for your loved ones and for yourselves. So I hope you're proud of yourselves for choosing to learn more about such important topics that are affecting people in Lebanon and even outside Lebanon, like your loved ones and yourselves. So it's a great thing that you chose to join us today. We have a message from Impact Lebanon. Thank you to our panelists, moderator, and everyone attending. And don't forget to register to our upcoming events tomorrow on the link that was just put on the chat. Do we have any final questions, everyone? Okay, so we're at the end of this webinar. Thank you again for tuning in. Have a great rest of the day, and we'll see you tomorrow for day 2 of our exciting Mental Health Awareness Weekend. Everything
Have a
is
great
available.
weekend,
Thank
everybody.
you so much. Everything is available on Impact Lebanon's Instagram account if you would like to find out more. Thank you to everyone who's been involved. Thank you, Impact Lebanon. Thank you, Nathalie, for joining us, and have a great weekend. Bye, everyone.